Good morning, everyone. Welcome to Family Fridays. We are so glad that you're back with us today. I'm Rachel Poisky, one of the Connect coordinators in Texas. Today is a great topic. It's advocating for yourself and your child in clinical research. The good part about all of this is that the landscape has changed and we have clinical trials for Duchenne. But then that also becomes a difficult part to know how do we advocate, how do we walk through the system, what trial is best for our child. So today we have some experts that are going to help with that. Before I introduce them, I want to make you aware of our annual conference. Uh, COVID's made it virtual. It's going to be July 22nd through the 25th. You do have to still register, so please go on and register. This is going to be just a great opportunity to learn a lot about the research landscape and care for your child. PPMD is bringing a lot of good information. So I just encourage you to go online and register so you can watch from the comfort of your home and do that today. And we will, there's also, I think we had mentioned last week about a newly diagnosed, and that's earlier in July. And so please check that out as well if you want to sign up for the newly diagnosed conference for anyone who's been diagnosed. I believe it's January 2018, but all the details are on the website. So now I want to introduce our panelists to you for today. We have Michael Losapio, who is a parent who's going to talk about his experience with his two sons in terms of clinical trials. And then we have Maina Scavina, a neurologist from Nemours DuPont Hospital in Delaware, and she will share from kind of the neurologist side of things. And then Eric Camino, who's on staff with PPMD and is the Director of Research and Clinical Innovation. So the way it will work today is we will walk through and listen to each of these, and then if you have any questions about clinical trials, mainly more general questions than a specific trial, but if you have some questions, you can put those in the comment section and we'll try to address them. And then I'm really excited because Eric at the very end is going to walk us kind of through the research pipeline. Where do we go to get information on what trials are available and that sort of thing. So stay tuned for that at the end of our session. So I'm going to start with Michael. Can you please just kind of tell us a little bit of your journey through clinical trials?
Sure. I wanted to thank everybody, especially PPMD, for inviting me. I'm super honored and thrilled to be able to share my experience with my two sons. So I live in Townsend, Delaware. It's about 30 minutes north of the capital, Dover, in Delaware. And we live on a small little farm. And I live with both of my boys, Michael, we call him Mikey, and Reed. And both boys are living with Duchenne. Michael has been in for 3 years in a clinical trial for NS Pharmaceuticals exon skipping 53 drug, and Reed just recently NS Pharma launched a few months ago their expanded access program for that same experimental drug, and Reed just finished up with his fourth week for that. So while at clinic every 6 weeks at Nemours or DuPont Hospital for Children, Dr. Scavine is our neurologist, and I also had the pleasure of teaching her son, and I'm a high school teacher. And she noticed that I guess, kind of dove headfirst in to a lot of the research, and I had like a notebook that I would bring to every single one of our clinic visits. And she said, geez, you know what, I'd love if you could help us out a little bit in clinic and help parents kind of navigate towards clinical trials. So kind of with the knowledge of going through it myself, it was nicer to be able to kind of talk to some of the parents through email, phone conversations, even having some over my house, just to kind of go through with them the process that I went through with finding the clinical trials and talking to your neurologist. And I could talk for this for like 30, 40 minutes. So I'll try to narrow it down to the exact, I guess, kind of experience that I had. So the biggest thing that I could give advice for any parent is to make as many phone calls as you want, they're your children, and you can ask as many questions as possible, and to kind of learn the lingo. That's my biggest kind of piece of advice. So in the clinical trial world, there's lots of different lingo that you may not understand fully. So learning things like inclusion and exclusion criterias, the sponsors versus the collaborators in a trial, that really helped me to be able to contact people. So with the Duchenne registry, which if anyone, this is a big plug right now, so if anyone hasn't registered for that, make sure to register. You can as your kids, you can register as a carrier or a parent. So it's an app. Make sure you do that. PPMD has an awesome, easy tutorial of how to do that if you haven't registered yet. And then Eric, which we'll talk later about the interactive pipeline, that wasn't running yet 3 years ago when Michael was looking for clinical trials. So what I did was I went on clinicaltrials.gov along with the Duchenne registry, and I looked for anything that could help the boys. And I just made a detailed like ledger journal for myself about every single trial that was going on. And then I talked to Dr. Scavina because there's so many different goals for every single trial. Some are anti-fibrosis, some help the heart, and then also looked at the inclusion exclusion criteria. So as like a parent, I guess I can say the biggest advice is there's so many trials going on, but in the infancy of it, I kind of had to rein myself in of excitement to say, okay, I have to look at this on a very systematic, clear level, that I can't be so excited. Oh, my kid can get into that one or get into this one. So not to be like ready for disappointment, but just to be kind of realistic about it. To say I'm looking at this. There's stuff out there. It's in the pipeline, but what can fit for my family and my son? So after I figured out where the trials were, then I kind of hit roadblocks because on clinicaltrials.gov it would say like it hasn't been updated for 2, 3, 4, 5 months. So what the heck? So what I did was I kind of got a little pushy, nosy, or I don't know. I put on my parent hat and I'm like, I'm calling people. So I just started calling the sponsors and the collaborators. They don't really have their phone numbers on the website per se, but you can just look. I mean, you can just do a quick web search. So I did that, and then I just bluntly asked questions. When is this going to kick off? And sometimes they couldn't tell me, and they were super polite. And every person I spoke to was more than willing. They were excited to talk to me about that process and when it was going to launch. And wow, that's really great. And they said, we haven't even collected names yet, but I'll start a list now, and you'll go right on the front of it. So I said, that's perfect. This works great. So, and if they, like I said, if they can't answer a question, they'll tell you. And sometimes as a parent, just knowing why, like when you look on the web and you just see, launching in spring, but then you talk to someone, you're like, oh, well, that's because we're still getting IRB approval. We just have to get it running, but it's going to launch. We just have to wait until this is done. And as a parent, that like brings your anxiety level down just a little bit and kind of something to grab onto. So I got Michael on the lists and stuff, and then he was the kind of first person that they were going to chat with down in Richmond. So Richmond is about 210 miles away from us. So with the clinical trials, please ask all of them what they pay for, and that's not a huge detriment to a lot of parents if you can get them there. So some will pay for a plane, a car, we get a rental car every week. They also give him a voucher for a meal while he's down there. They reimburse me for gas. So a lot of clinical trials are used like a credit card. It's called a Clin card or whatever company they use. And you can do that. I also launched into looking towards, you can use FMLA as long as you're a full-time worker. And you can use that by the half hour. I didn't even realize that until I got into it, where if you have to take your son to a clinic visit, you can take FMLA. It doesn't have to be this big chunk of 3 months. You can do it sporadically. And as long as you fill out the paperwork and hand it to your employer, they really can't legally do much for you. Fortunately, I'm a high school teacher at an all-boys Catholic prep school, and they were very, very they were more than willing to allow me to take time off. So Michael's visit was every Thursday for 3 years. So it's still going on, but they're now doing home infusion visits 3 times out of the 4 in a month. So only once a month we have to go to Richmond. So it was a process. It's daunting. I even looked at a trial out in Ohio for Reed that he'd have to fly there to, and I just asked them to send me a printout of what they pay for, and they did. And then you can match that up with, okay, can I miss work? Can I not? Do I have other kids at home? And so there's lots of scenarios, and I've always found that the companies are really great with communicating. The collaborators, those are the companies that are hired by the sponsor slash drug company to help you. So the collaborators for this one was called Trins. Synergy is a subgroup of that, and they were like they have teams of patient advocates. They have teams at the pharmaceutical companies who just do patient advocacy. So as long as you keep like a detailed booklet type thing and write those people's phone numbers down. I did that every time I talked to someone. Okay, could you spell your name again? Well, what's your direct phone number? And I've never had someone say, "Oh, we don't give you our direct phone numbers." So, oh my gosh, yeah, yeah, just give me a call. It's such a hassle to get a voice message and then try to call you back. So, I found that everyone was like welcoming me with open arms. It was just you had to figure out through kind of the fog who they are, where their phone number was, and then just contact them. So it worked out very, very fortunate for us because the boys were amenable to those things. But there were other options out there. You just kind of have to narrow it down. So I feel like I've been talking a lot. So I don't know if anyone has any questions or not.
Yeah, that's great, Michael. I'm definitely, if you have questions for Michael, put them in the comments and we will send those over in a little bit. I really appreciate what you spoke about, just taking in the whole thing, that it's not just getting in a clinical trial, but you have to think about just the financial implications and time implications on a family because it's significant. So thank you for reminding us about that, and the Duchenne registry. That is really important. Now I want to send it to Maina, and from the neurologist side of things, just help us understand how we can advocate for our kids through this whole process.
Great. Well, thank you very much for inviting me today. Um, as you can see, I have a great example of a parent who has taken that challenge on and done a beautiful job. And as always, he's 10 steps ahead of me with what he's doing. And I could see that in clinic. I saw that he knew about trials that maybe I hadn't even read about. So I said, hey, listen, would you like to collaborate and work together? Because even though I've been at Nemours for about 25 years now and in this space, this is a time of an exponential number of trials opening up. And as much as I do see a number of patients with Duchenne, also see children with other diseases with those trials. So having a parent like Mr. Losapio who's really focused on this area and looking at trials. I mean, he will send me emails in the morning and say, did you see this trial opened up this morning, or they're going to do this, or they're going to do that. So he was our clinical trials point person, and we shared his number with newly diagnosed families. And they appreciated that, not only to say what is available, but what is it really like? What is it like to go there once a week? What is it like to bring your 5 or 6-year-old to a different hospital and go through everything that you've done? And many families have felt that very helpful. From my standpoint, we are a smaller institution, and I don't have a current drug trial. I do participate in studies with individuals at University of Delaware and Jefferson in non-drug trials, looking at vascular resistance, looking at upper extremity devices. So those trials I can welcome families from our clinic to participate in, and I offer those. And I think in speaking with many of my colleagues at larger institutions, they also will talk about what they're doing at their institution if it is a drug trial. And then what do we do to tell families about other trials? Clearly the PPMD pipeline and site on their website is, I think, a godsend because it's very organized, it's very thorough. It has the names of the site coordinators where you can speak with them, contact them. And so I appreciate that, and I will refer families to that. I also use the clinicaltrials.gov website. And as you know, in clinic, there's a lot going on. So when this topic comes up, we say, these are the sites, go home, sit down when you have a quiet moment, look at them, and then think about what would be the appropriate trial if you want to do this for you and your child. And then come back to us, talk to either myself, someone else in our clinic, and also talk to this study. And then conferences and things are, I think, very helpful. Unfortunately, this year it's going to be virtual, but I think it'll still be very helpful where you can talk to other people who've been through that trial and what's positive, what's negative. I think even on the PPMD website, there's a section where you can look at pros. You can actually list pros and cons. They've made a very nice section so that in your mind, you know what you're headed towards. I'm in the midst of a decision making for a family member. And looking at the website just the other day on the PPMD website about engaging in a clinical trial, I thought that's what I need to do. I need to look at a pros and cons for myself for a family member. Do I go here or do I go there? And so it's not easy. It is not easy. It's not easy for me to recommend to someone sometimes. And I think with all the choices, as much as the choices are a beautiful and very empowering thing, it can be anxiety provoking. And I've sat with families who've said, I just don't know if I should do that one, or should I wait? Should I start steroids or should I not? And so the phrase, we're all in this together, is out there right now with all of this COVID information that we're seeing. But we really are all in this together in the sense that it's hard for me to say what's right and wrong, but what is right for you, your child, and your family. So I would encourage you to educate yourself as much as possible with the information we have available. Come to the people that are working with this. And I, as a neurologist, when some of the decisions that Mike Lasapia was trying to make even struggled with. And I turned to Kathy Kinnett and Ellen Wagner. We were together and said, PPMD, you know sort of also what's happening. What do you think about this? And they are a great resource. So I encourage you to ask, to reach out to people, and then come to a decision. And I hope I can say it's all right to say that there's no right or wrong. It's whatever feels right to you for your son, your daughter, or your family.
That's really helpful, Mina. And what I heard from you that I think so helpful is reaching out to your doctors, to PPMD, like getting input from people about things, and not kind of just going down a path on your own, but asking a lot of questions, and that people are available to you, and that your neurologist is available to. That they have networks you may not know about to reach out. So I think that's great, and I just appreciate what you're saying about how Michael kind of came ready with, and I think we talked about this maybe last week too, but coming ready with some information to bounce off of you and to ask and that sort of thing, to do some homework before you come in, so that can help the situation as you're trying to make these decisions. So now I want to invite Eric, and also invite you to send your questions in so we can kind of answer those. But I want to ask Eric now just to talk a little bit from his side of things.
Yeah, hi. I'm Eric Camino. For those who don't know me, I'm PPMD's Director of Research and Clinical Innovation. And so I manage a lot of PPMD's research strategy, and I work on a lot of our projects for accelerating drug development. And so that's come out with some really great projects. So, working with industry partners to come up with some harmonization guides. So kind of what Michael talked about, things like covering travel for clinical trials. Those are conversations we have with our partners in industry to make sure that those are standards. Prior to joining PPMD, I was actually a clinical research coordinator at Nationwide Children's Hospital, working for Dr. Jerry Mendel. So I do have some experience from that side of the clinical trial landscape as well, and interacting with families. One of the studies I was on there was the manifesting carriers. So some of the people on this call we may have met already. And now, as part of PPMD, some of what I work on and help with our communication team is to develop resources that can help you better understand the clinical trial landscape. As Maina indicated, there is a lot going on within drug development in Duchenne right now, which is it's very exciting, but that is a lot to take in for a family. Especially, you may not have a scientific background, and so that just adds extra levels of complication. So we have a lot of tools on the website that are there to help you kind of sort through this. So there are a good list of questionnaires of things to consider before joining a trial. I always, when I talk about this, say, ask as many questions as you can possibly think of when you're talking with the clinical trial coordinators or the PIs on the study, the principal investigator who might be leading it from that site. They're there to answer those questions, and if someone can't answer it, they will be able to find someone who can, and that's really important. We want you to feel confident about whatever trial you're going to participate in, and it's also good for helping set some expectations, given that clinical trials work with investigational products. So these are experiments. In a sense, we don't know whether the product is going to work. They're testing safety, they're testing efficacy. So how well does the product perform, and if it provides benefit. So these are all things to kind of keep in mind. And then, as Rachel indicated at the end of this session, I'm going to walk you through the website where to find our exploring clinical trials. So we have a trial finder tool, and then we have our interactive pipeline, which talks about the different products in some family-friendly language and helps connect you to the other resources we have on the website. So with that, I think I'm going to pass it back to Rachel.
Okay, great. Thank you. So now I just want to ask a few questions. The first one I want to start with is regarding involving your children in the decision process. And I'm going to ask Michael about this. I think sometimes we, as parents, we know what we want, and we want to push our child to be in a clinical trial or that sort of thing. And we also know the Duchenne personality can be interesting sometimes. So I just want to ask Michael, like, how did you involve, your sons in the process of deciding if you're going to do a clinical trial? What did that look like for you?
Well, Michael was only 3.5 when about 3 3/4 when I saw this kind of this exon skipping 53 drug Larson by NS Pharma kind of pop up. So he was kind of young, but Michael does suffer a bit from kind of social anxiety and kind of new situations. He gets really, really, really quiet in. So I do know that there's other boys who could suffer from tactile problems, autism. Just because you have DMD, it doesn't preclude you from anything else. So I talked to him about it because he was going to be having to miss. He missed pre-K once a week, first grade or kindergarten once a week, and then now first grade a few times throughout the year. So I talked to him about missing and stuff, and then I made it kind of a enjoyable process for him to go to. So I am a parent, and I am not above bribing my kid. So every time we went to Richmond, we got a different item. I know that the sites were unbelievably nice. I mean, every time we walked in, they'd have a different toy or piece of food or something. So Michael's thing, he's skinny like I am, so he doesn't have problems with the steroids of getting heavier. But his thing was donuts. So every week we went, kid got a sprinkled donut. So I'm like, that works for you. And then he was actually more apt to do his homework, to do his coloring, his artwork. He did with his grandma when he went. His grandparents would take him on certain times. So I didn't really involve him as much as saying, like, are you sure you're okay with this? I kind of created a scenario that he couldn't say no to, if that makes that sound like a mafia boss all of a sudden. But so he he really enjoyed it, and the people that were there, there's only 16 boys in the world actually in the trial, and there's 2 other boys at the site, so 3 total, and they became like our little family. We dressed up at Halloween, we exchanged gifts for Christmas. Like we did fun stuff, and they exchanged presents and stuff. So it became almost like an enjoyable type thing. And I know Eric said he worked out at Nationwide, and my one son screened out there as well for a different trial. Again, greeted with gifts, a patient liaison, Reed now at Nemours, Dr. Scavina's team there. They have kinetic sand for him and artwork, and it's just so I just kind of created a scenario that it was fun for him. I've become friends with some of the people out in other different sites, and I know one of the moms. She gets her son a different like exact kind of thing at a Lego store every single time they go to Chicago. So it became almost like a fun trip, and I do know for some of the parents who are having a little bit of caution from that travel and stuff, it became quite the bonding experience for he and I. Um, I live on a small farm, so I'd have to get up at 3:30 in the morning, and I'd have to feed all of our animals, and then put him in the car at 4 a.m. And then we would just drive the 3 hours to Richmond, and then do his stuff, and then we'd be back home by around 5 or 6 at night. So it was a long day for him in the car, but we talked about things that I'd never had I don't think I would have had that opportunity to in the past. Taking plane rides with Reed, and I don't know. I try to take a positive spin on it, and I think some of the parents could find something that works for your kid, and then you can actually do a lot of those things while you're traveling, and it almost turns into like, wow, my son really likes Sudoku books or whatever. Like he gets to play those for like 3 hours a day. This is so cool. So I, I think as they get older, um, just like I'm sure many of the parents watching or who will rewatch this, they'll admit you talk to your son about DMD at age specificity, and I think including them in the trial would be again that same thing. Like, how much do you really discuss with my 4-year-old? I didn't talk about like you're like he had to get 2 muscle biopsies, so that was like, oh well, you're going to get this little, you're going to sleep for a little bit. They're doing this, and I think if you're talking to like a 15-year-old, probably want to get their consent rather than like you can't trick them with donuts at that age. So I feel like you got to find your hook. Like many of us adults who are watching here, you think to yourself like, why do I exercise? Somebody could be like, I have heart disease. Somebody else can be like, I love it. You got to find your hook in whatever it is. So for whatever your family is, you got to find that hook that like it can be something fun, enjoyable. Like I don't know, it sounds super cliche, but turning lemons to lemonade or whatever. But find something fun out of it.
Yeah, that's great. So when my son was first diagnosed, I am not above bribery either, and I said every time you get poked with a needle, you get a prize, which was very bad for Duchenne because I don't know how many prizes I bought now, and he's 17 and still requires something when and he gets stuck with a needle. So just be careful what you promise because the follow through can be very economically devastating. I wanted to just keep going with that just a little bit more to Maina. Just Michael brought that up a little bit, but at what age do you think, just your opinion, a child should really be part of the decision making, where they have to be on board? So I guess I'd love to hear just your experience, and I know that's a little bit fluid, but at what age should they really be part of the consent process?
Yeah, so I think we have to take into account developmentally where the child is. So even though they may be a certain age developmentally, because we know that there's a whole, spectrum. So I would first and foremost say that. Um, just like with transition of care, people recommend that at 12 or 13, we start talking about transitioning, which always to me feels too young, but that is really when we start having these conversations about taking ownership of your care as you get older and through the teen years. So I think, really, and if someone is earlier than 11 or 12 and really has questions, by all means, that should be addressed with them. I think the push really now is to have boys, patients everywhere, engage in what they're looking for in a trial. I think even with PPMD, I was in a group that is looking at asking families and patients, boys, I want to say individuals with the disease itself, what do you want from a clinical trial? What are your expectations? And so, those early teen years, I think if you're going to commit someone to going to a study, they need to be on board and need to be okay with it. And again, I think the pipeline information is legible from a variety of different scientific and age groups so that they could look on it with everything that they have available to them on the web anyway. But I think in the probably 12, 13, 14, and maybe some earlier, some later, at least to lay out the information and talk to them about it. That would be my thought.
That's great. One question that has come through that I wanted to, I think I'm going to send this one to Michael because it sounds like something he's probably had to do as a parent. Is it okay to contact the clinic sites a second time if I realize I forgot to ask something in the initial conversation?
Absolutely, yes. So there has been so many times, like in every situation, you were even going to get your car fixed, you leave, and like, oh, I should ask the mechanic that. Like any situation. That's why I actually bring like a detailed booklet with me. But again, Dr. Scavino will mention like a couple different things and I'll forget. So I advise everyone to get the email address of your doctor. I'm very lucky that Nemours DuPont Children's Hospital has a patient portal, and you're able to send a message to your doctors, nurses. There's a whole list, like a drop-down menu I can use. And Dr. Scavina is like a rock star with getting back to people immediately. All along my journey, there's been people, many clinicians, nurses, they've given me their own personal cell phone numbers. They've text messaged me stuff. So definitely get back to the people. And I always say sooner than later, just for yourself, because then you'll forget. Like you've got like a 5 million things as a parent to do. So definitely contacting them would really help. And this is kind of, I wrote something down. I want to mention. Eric mentioned this. It kind of has to do with that, with the trials and also contacting people. But just so people know, the principal investigator, that's the doctor who is in charge of that particular like site at a hospital. So like at Nationwide, where Eric used to be, like Dr. Mendel could be the principal investigator on one of those trials. And then down in Richmond, there's a doctor there, and now at Children's Hospital, Laurie Children's Hospital, there's a doctor there. So that's actually how I really bugged the heck out of the doctors and nurses there. They did not have their phone numbers listed on the. I don't know if I should be telling people this, but I'm gonna. The they had the person's name, but there was no contact information. I'm like, well, how many? This could be easy to find. So I just went to like the Richmond Children's Hospital website and found Dr. Harper's phone number and then contacted her nurse. And you just look it up on their website. And then I contacted them and I said, hey, I was calling about the clinical trial. They're like, oh, I didn't know that was up yet. I was like, no, it's not. And then they just gave me all the information. So just learn that language. Like if you want to contact, like if you forget a question, you got to remember who you're going to contact. So the PI or principal investigator is the person running it. Sorry to go off on a little tangent, but it just kind of went together.
Yeah, no, that's great. But the summary is don't mess with a Duchenne parent, right? They will go down every rabbit hole to get the information they need, which is great. Eric, I want to ask you a question. With so many clinical trials going, which is great, how do you filter, especially if your child is qualifies for a couple or may qualify for a couple? How do you think a parent should approach that, making a decision which trial is best? Are there a few good questions to ask to make a decision on that?
Yeah, so once you've kind of gone through the process of narrowing down and you find out, okay, here's the handful of trials that my child is in the age range for, and whether you're on steroids or off steroids may be part of that inclusion or exclusion criteria. So once you've kind of narrowed that down, one, I'm always going to recommend that you talk to your physician. They're very likely to be knowledgeable about the product and can probably provide some really great guidance. I think the second thing to start taking into consideration is some of what Michael's already pointed out, which is talk to those sites, get more information on what that clinical trial design looks like. Meaning, how many visits am I going to need to do in a year? Are these weekly visits? Some of the investigational products might be a weekly infusion. Some of them might be an oral drug that you can take at home, and so you only need to come into the clinic once every 3 months. So what can you manage with your schedule? And then how far is the trial site? Um, it may be something where it comes down to convenience that, this is in our city, we can go there, we can make this commitment. It might be something that you're really excited about and is a 5-hour drive away, and you think you can tolerate that, you think your child can. So those are the kind of things that I think you can really do to start narrowing down what trial to pick. If you don't um, have an idea based on reading a little bit about maybe what the drug does or proposes to do, and again talking with your clinician if you don't identify it that way, look for some of those secondary things that are going to have an impact on your life, because I think that's the biggest challenge for families participating in clinical trials. Is it is a disruption. There can be a lot of benefit to it, but it's something to keep in mind.
Okay, great. I have another question I'm going to send to Eric. Uh, so for some of the older boys, that may be on the edge of a clinical trial, but they don't qualify, or they may be close to qualifying. Is there, how do you decide, and is there any point in bugging the clinical trials to get a child in that may be close to the criteria but not in the criteria? What do you say about that?
So if that there is the aspect of I would talk to that trial site and see if you can come in and maybe test for the inclusion criteria. If it's something like the time function tests, you might be able to test and see if you can get in there. If it's something like an age cutoff where you've aged out, that is kind of an unfortunate side effect of some of these, where there's not always something that can be done. Depending on the sponsor and what their expanded access program is, there might be ways to go through that, but that's kind of a much deeper and I think in a longer conversation to happen, what we can probably do in this bit of time here. But that's something that, reach out to the sponsor, and then I would say, reach out to us here at PPMD and talk to us, and I think we'd be happy to help maybe try to provide some guidance for what we can do in those situations.
Can I add to that also, real quick? The sponsors, i.e., the drug companies, please reach out to them and tell them that the age criteria was not something that you really liked, because they don't know what they don't know. So if you are in the age bracket of having a 12, 13, 15-year-old DMD boy, odds are you probably know other parents that are in that same age bracket or same boat. So I contacted the sponsor and asked them about like expanded access over and over and over again. And other parents contacted as well. So like some of them feel that pressure. And I know I've heard Pat Furlong speak about this at the conferences where like you have like get in their ear, tell them about it. And then I've heard the sponsors speaking at the conferences say, this is the only group like that allows the sponsors, the clinicians, the parents all to be in one room. So they're learning from us as well. So if they know there's 6, 8, 10, 15 boys who have aged out or are not ambulatory, and they're like, well, we have all these kids willing to participate, they may down the road do something, not just for that trial, but maybe other companies will hear about it. It's kind of like a snowball effect. So kind of put on that, I don't know, that angry parent hat and just go after them.
I like that. And I will say, I've experienced a couple times myself where I would go and it would appear my son did not qualify, and then I would check back 6 months later, and they would have upped the age range or something like that. So I think once you go and see a trial and you're excluded, don't stop going and looking, because at times the criteria can change, or a different trial, or at a different site or something like that. So don't give up if you find a site that seems like it excluded, because something else might open up. All right, I have a question for Maina that we'll go to before we go to Eric for our pipeline. Um, can you just explain to us a little bit? We had a question about what is compassionate use and right to try. Can you kind of break those down for us, Maina?
Sure. I'm in the situation right now, actually, and I think it's okay, Michael, to discuss this a little bit, in that the medication that his older son is currently involved in a trial format, his younger son was too young at the time of the trial. And so he and other family members, and then he asked me to write a letter to the sponsor asking for this expanded access. The woman I'm working with in our research department says, we call this compassionate use. So different names perhaps are used for it, but in a sense, the company is saying we are providing this without outside of the boundaries of the clinical trial, because there may be a benefit, and but you, the physician and the parent, are responsible basically for this. They are giving us the medication. We have criteria to follow, but we're not in a clinical trial, and basically the responsibility is on us. But we are providing this with the hopes that the same benefit his older son is receiving through a clinical trial, his younger son can receive outside of that, through this compassionate use, if you will. And again, right to try, and correct me if I leave out any details. Again, the idea that you're able to obtain this drug for trial outside of a formal clinical trial protocol, with the idea that there has been benefit seen, but your child does not fit into the box that they want that seen in. And so far, it took some time to get this approved. I had to petition the FDA. So we had to put an application into the federal government for the approval. And then the company, once they had all that information, a lot of laboratory testing and so on, said, okay, we're going to give this to you. And basically you're responsible. And so that's fine. That's a responsibility we've taken on, to do so, to try to provide a benefit, for Mr. Lusapio, for Michael to say, I have one son receiving this medicine and another son who's just a little bit younger, not receiving, seems, unconscionable. And so this is a means of working with a sponsor to obtain a drug.
Great. Michael, do you have anything you want to add to that?
Yeah, just with, I guess, the parent hat and the helping out with the clinic hat as well. Just because you ask for it doesn't mean that the sponsor or pharmaceutical company is legally liable to give that to you. So that goes for Duchenne stuff or cancer treatments or anything. The NS Pharma, who their headquarters is Nippon Shinyaku in Japan, they were rock stars and made a announcement that they were launching expanded access and welcoming that. So traditionally, through right to try or expanded access, compassionate care, you can go to the FDA website and print it out for almost any trial in the world for any disease, and you submit it, which Dr. Skimina can attest is a lengthy paper process. And then that gets sent to them, and they can say yes or no. It's totally up to them. So NS Pharma was very, very. Sometimes it can't. So that was, them allowing it was great. So just don't. I don't say don't get your hopes up, but just talk to the company, call them on the phone. That's what I did first. Don't, like, sometimes if you just send something and they get it on their desk, they're like, "What the heck is this? Who's this for?" So they. The people at NS, they very much knew my name, my voice, and my phone number. So they knew that it was coming on their desk. So it was like a process. So I always say talk to them first. So that's my 2 cents, I guess you could say.
Great, thank you for that. Now I want to invite Eric just to share with us the pipeline and where we go to kind of get information about all of these specific trials. Eric?
Yeah, let me know if, can you see my screen? Okay, perfect. If you come to the PPMD website, parentprojectmd.org, if you come over to research, I'm going to show you 2 different areas on the website to look for. So there's this clinical trials section, and there's also current research. So under current research, down at the bottom here is where we have our drug development pipeline. And so this is something that we launched this past September of 2019. And so this is our interactive pipeline. And so on here, we have all the different investigational products. We have them grouped by different therapeutic areas and therapeutic approaches. And you can click this link to learn more about those different ones. And so this is really just a resource for you to learn about what different products are in trials and where they're at. So for instance, one of our, the first grouping on here are products that are looking at restoring or replacing dystrophin. And so you can see then, what a product is. So something like exon 51, which is approved, is, all the way to the right, 2 patients, little check mark. And if we come down to something like Adalorin, you can see that it's in phase 3 currently. And so we have this for a bunch of different areas and a bunch of products. So there's combating fibrosis, reducing inflammation, regulating calcium balance, improving muscle and protection, restoring the energy of cells, and improving heart function. And so then if we click on any one of these, what it's going to bring you to is the landing page for that particular product where you can learn more. So there's a nice description of what the product is, what potential benefits there might be. We have some information about the status, so you can see, what phase of clinical trial is in, and if there's any other announcements. So for something like Adalorin, where there's conditional approval in the EU, we have that information there for you. You can see who the industry sponsor is, and then a number of the current studies that are related to this product. And then our media library. So over the years, a number of these companies do webinars with us. I'm sure many of you participated in them. We house them here so that way you can quickly go back, hear from the sponsors on the different trials and the products. You can learn a little more. And then if you're trying to kind of sort through what trials you might be eligible for, if you go again to the research tab in our clinical trials, we have Explore Clinical Trials, which is going to bring you to our recently revamped trial finder tool. And so this page has trials that are actively recruiting, that are maybe getting ready to recruit but haven't opened up yet, trials that are ongoing, so they've already hit their recruitment, information about some of the open label extensions that typically follow some of the trials, and then a little bank of definitions. And so you can go here and you can look through and try to find different trials, that fit different, ages. So this one is 7 and up. You can kind of sort through at the top by age or by therapeutic approach, if there's a specific mutation or if you need to use steroids. And then if you want to learn more about any one of these, you can scroll down and we'll go back to the Adalorin one. The pipeline button here is going to bring you back to that page that tells you more about the product. And then you can go down and click on any one of those trials, and it's going to take you out to the clinicaltrials.gov webpage. So it's a lot of information at once, but by playing around with those tools, you'll be able to help identify some trials that you or your child might qualify for and learn more about those different products. And then the last one is, of course, Michael mentioned it at the beginning, the Duchenne registry. So if you sign up for the registry, one of the great things about it is you're going to put in information for yourself or your child that says, here's the age, here's some of the different, whether I'm on steroids or not. And so when we help recruit for a trial, you will get in targeted email blast that says, you are in the right age range for this particular trial if you are interested in participating. And then you can learn more about what is going on with that trial. So you're not going to be inundated with, trials that are, just for ambulatory boys if you have a non-ambulatory boy. So it's another great tool to use to help be alerted about clinical trials. So, and with that, Rachel, I think I'm going to pass it back to you.
Okay, great. Thank you. That is really, really helpful. I'm going to spend a few hours on that site tonight myself. So thank you for that. And if you do go through those and you find you have some specific questions and kind of don't know where to start. That's okay. Ellen Wagner, who works for PPMD, you may email her at ellen@parentprojectmd.org. I think she's going to put it in the comment section there. And just reach out to her if you are kind of wondering about some of this stuff as a first, if you need a first step person to contact, you can reach out to her that way. But this is just some great information. And you know, I've said this before, but when my son was diagnosed almost 14 years ago, there was basically nothing. Just a couple of we immediately went to clinicaltrials.gov and just found a nothing, basically. And now to see what all is out there is so encouraging, but it can be overwhelming. So that's why Parent Project is here and has that website for you, so that you can get all the information you need to make the best decisions possible for you and your family. So thank you so much for joining us today for this Family Friday. We hope that this information has been helpful, and again, continue to reach out and please go and sign up for the conference. You'll get a lot more information, especially about some of these clinical trials and specific care considerations for your son. So thank you, Eric, Michael, Amanda, for joining us, and we will see you again on Family Fridays. Bye-bye.
Why? Thank you.